Hello, I'm Andrew Gloster. I'm a family physician here in Redlake, Ontario. Redlake, Ontario is a small town of 5,000 people located in northwestern Ontario. We have about 15% of our population is Aboriginal, and we have a large number of miners. We have a large gold mine in our community. Some of these miners live in town, some of them fly in and live in the work camps. We have 7 doctors and 3 nurses presently here. At the hospital, we have X-ray and lab. We have an emergency department there. So residents typically work in the clinic, and when they're on call for the walk-in clinic, and then we'll also be on call for the emergency department. We also do obstetrics. Now, if you admit a patient while you're working in the emergency department, you will follow them as inpatients, and after discharge, you follow them up in the clinic. So there's good continuity of care here. We don't have any specialists actually residing in Redlake, although we do have an orthopedic surgeon who comes up a few times a year, as well as a general surgeon who comes up about once a month. In terms of distances from neighboring cities, it's quite a distance. It's 500 kilometers to Winnipeg and about 600 kilometers to Thunder Bay. There's a lot to do in the area surrounding Redlake, but it's mostly outdoor sort of activities. Fishing, skiing in the winter, skidooing, and boating, things like that. So the average day for a typical resident we start our clinic at 9 o'clock, and they have booked appointments. When you're on call, as I said, then you'll cover the walk-in clinic, and that can be variable in terms of how many people show up. However, the emergency department, which you're also on call for, takes precedence, so if there's something going on there, you'll be called over there. In addition, depending on the interest of the residents, we'll call you in for anything that's interesting that's going on in the emergency department or obstetrical cases, just because we don't get as much as that as you would in a bigger center. We typically schedule 20 to 30 minutes for each patient, but a lot depends upon the resident and how things are going, and also how complex the patients are. And you see patients on your own, and we will be reviewing the notes with you. You'll always be working with one assigned doctor every day. So we do obstetrics, so there's a fair bit of prenatal care. A lot of our pregnant women go out to deliver in bigger centers because we don't have any C-section backup. There's no operating emergency department. So I would say at least half of our deliveries to patients in Redlake occur in other communities. I think we tend to have about 15 to 20 women who deliver every year in Redlake, but we only do low-risk obstetrics. Two of our physicians are coroners, so if you're interested in that aspect of work, you can discuss that with them, and so if there's any cases that occur while you're here. And we do tend to have a number of palliative patients, both in the hospital and in the community. We do try to allow the residents to vary their schedule according to their needs. So if you like to do more walk-in or more emergency, or have a very strong interest in obstetrics, we can make sure you're involved in those cases as they come up. And the way we work here is you're not actually working with one preceptor the whole time. You'll actually be working with whoever's on call that day. So that you will actually work with a number of people in our community. Our EMR is Practice Solution. In terms of procedures, we do lots of lumps and bumps, and then whatever comes up in the emergency department. So slit lamp exams for ophthalmological problems, using the burr tool if there is a corneal foreign body that needs to be removed, aspirations of knees, doing shoulder injections, an occasional chest tube if there's a bad trauma that's coming in. But it all depends on what's happening in the community at the time. So we can't guarantee your exposure to any of these procedures. If you would like more call, or we can also set things up so that you can cover the emergency department in the evening if you're interested. The accommodation is at a NOSM house, so that's the Northern Ontario School of Medicine. They have actually an apartment, and I think it has 4 rooms in it. The distance from the hospital is probably, I'm thinking, about 1 kilometer. When you come up here, the community has provided a rental car, so you'll have use of that. There'll be one car for all the residents and all the medical students. Obviously, if you're on call, then the car is yours for the call shift. Utility for leisure environment, leisure activities. A lot depends on what you're interested in. If you wanted to go canoeing, I'm sure you could borrow a canoe from one of us here. A lot of us have kayaks, and there's a lot of fishing, hunting and fishing, and cross-country skiing. So a lot depends on what you're interested in, but it's mostly outdoor activities. One thing we can offer you is what's called the key to the town, which allows you to golf at the golf course, go to the recreation center for if you want to do a workout. I think it also covers cross-country skiing on the groomed trails here. And we have a number of restaurants in town. One other thing that we sometimes are able to arrange is a visit to one of the reserves, which provides you with the opportunity to see what life on a reserve is like. And in addition, sometimes we're also able to arrange tours of the mine, which involves you going underground for 6 or 7 hours and seeing what the working life of a miner is like. But it's got a lot to offer. If you like the outdoors and you like to have a relatively independent residency experience where you get to do a little bit of everything with a lot of continuity of care, then this is the place for you.